Okay. So good afternoon. And so I'll set. It's been a busy 24, 36 hours with the situation with the COVID-19 being quite fluid and changing with numbers and details. And I know Dr. Yaffe will give you some idea of those numbers shortly. And of course, things on the global basis with the Executive Director General of the WHO declaring a pandemic. On that, and then how we are continuing to ramp up our response here in Ontario, as we've alluded to before, with our plan, with our command table, and looking at different things that we need to do to respond to these changing situations in that light there. So first of all, let's look at some of those numbers there and what's going on in Ontario at this time, and then we'll speak to that and what steps have been taken as you received some information just now, and other steps accordingly to look at the ongoing protection of the Ontario situation, as well as our containment approach of dealing with COVID-19 here in Ontario at this time. So over to Dr. Yaffe with some updates from the Ontario numbers and some other global issues.
Thank you very much. So as Dr. Williams said, it's definitely a very fluid and evolving situation. And certain countries, still continue to have escalating numbers. For example, Italy, rapidly changing numbers. Iran, Germany, France, Spain, the United States. So in terms of the Ontario numbers, we have at this point a total of 59 cases that have been reported. 5 of them have been resolved. So we have 54 active cases. There's been quite a jump over the last 24 hours. We had 17 new cases reported, and about 7 of those had traveled to the United States. So that's something that's a new pattern that we're seeing. The lab has had increasing numbers of specimens submitted each day. For example, yesterday they tested specimens for about 550 people, plus another few hundred for our sentinel surveillance, which are still negative. So the numbers are going up. I just wanted to add as well that the Public Health Agency of Canada has added Italy to the list of countries where if you are returning from that country, when you enter the border, the CBSA, the Canadian Border Services Agency, will give you information. You will have to fill in a contact form of where you're going. You will be asked to self-isolate for 14 days and report to local public health. To date, that has only been for Hubei province in China and Iran, and now we have just added Italy. So with that, I'll turn it back to Dr. Williams.
Thank you. And in light of that, listening and looking at with the WHO and what are we going to do with around aspects with social distancing and things to deal with those matters, as you've listened to some of the recommendations that containment and case following and contact tracing is still the best tool. And that's what we're doing here with full force with our even these 17 cases, all travel related or contacts of cases in that regard in there. Excuse me. And what we're in that data there, I was asking last week because I was concerned with the upcoming aspect of the March break and many people going away. Do we have a lot of data on infections in children, yes or no? There wasn't a lot of data, none in Canada yet, but yesterday in the last 24 hours we have 2 cases under the age of 18, one quite young. That substantiated my concerns that children can have it and be present in that, especially if they're contact of cases, as these cases were. And while I don't believe there's much illness, it does give the potential of bringing back infection and introducing it into various settings, including schools and daycares. In that regard, it was my recommendation that people who have traveled outside of Canada at this time, if you're normally if you're coming back, as besides the 3 zones that Dr. Yaffe's alluded to, where you have to be mandatory quarantine and to fill out the questionnaire when you come across the border, we're also saying any travel outside of Canada, those who are coming back even from the U.S. will have to self-monitor for 14 days if they develop symptoms to present themselves to public health for assessment and potential testing to rule in or out COVID-19. As you, Dr. Yaffe said, we've had just recently a lot of cases from various parts of the USA, and so that concerns us in that regard. Besides that, I'm saying that those who travel, and especially come to the March break, if you choose to take your children with you, when you come back, you're going to be asked to keep the children out of public settings, in the home setting, in isolation, for the 14-day period, and not introduce them especially into the school system or into the daycare system there until you complete that 14-day period. The parents can continue to self-monitor in there, but if they develop symptoms, or if you or your child develop symptoms and prove to be positive, then of course you would all be contacts of that case and you would be in isolation for a further 14 days until that whole situation is resolved. And I think that's an important step to add to our containment policy to make sure they're not introducing into our school systems and into our daycare systems infections in that regard. And I think that's the thing that I would encourage parents to continue to be responsible in. One, to make a careful decision, as we said before, when you're doing your travel plans. Are you potentially introducing some risk and aspects there? And at the same time now, adding to that for parents who don't and are concerned about daycares and schools, that they're not going to have their children potentially exposed to someone who's had some travel history recently in that light there. You'll see that there has been an announcement also in there to add to that, that there's going to be closures of schools for the week of March break and for 2 weeks after that. And that, I believe, you're going to get some more details from the Minister of Education, who's going to be following us to make some comments about that and details there in that aspect. So that's one aspect of dealing with the uniqueness of the situation rapidly evolving, especially in the USA, combined with the March break, which is a big time of travel, and impact on our school systems. Add to that further, we've had some discussions about what to do about large gatherings. And you can see there's been a lot of news and announcements by a number of large sports entertainment venues who have chosen proactively to postpone those events right for now, especially for the next 4 to 6 weeks, especially as we go through this time. As you remember, on Tuesday, I was talking about this is a time of heightened precaution. And that was a serious comment about personal precaution, but other things of not introducing risk into the situations here as we go through this time of wide exposure to different areas potentially of international travel and outside of Canada. And my decision on that is that if you have gatherings of over 1,000, I would prefer that you did not hold those events, that you would postpone or delay those. If there's ones like 250 to 1,000, I would ask again, as I said before, that you just consult with your local public health, because some events we do know are publicized, some we don't know, and you would consult with them to say, again, what is your risk assessment of that situation? Is it an indoor venue? Is there people in closed spaces for a prolonged period of time? Are there international people coming to that? People that you know might be, or you have no idea if they've been exposed, yes or no? And what is the content of that event? And how long is it going to be on for? All those can be taken with the event, or the idea of saying maybe you should cancel or delay, or maybe you should change the venue. Maybe you should use virtual or some other methods to reduce that potential to a number under that amount so you can reduce the potential amount of contact. So I applaud those organizations that have taken proactively that step to reduce that risk at this time, because, as I said, in the 2 weeks and the next 2 weeks after this, as I said on Tuesday, this is a time of heightened caution and to reduce that potential of introducing community spread within Ontario, which we have not seen as of this time. So those are the main things we want to talk to you about today and to answer your questions in that regard. As I said, a number of other, I haven't said yet, but a number of my partners or fellow CMOHs across the country are undertaking methods to deal with potential exposure during their March break periods. And I think you'll hear some announcements on that, or you may have heard them already from other provinces and territories as we seek to make a consistent way of trying to manage it, with variations, of course, in each province and territory, because our systems are different and even our March breaks and periods are slightly different from each other. And how do we do that to try and keep our numbers in Canada into a containment-type mode, and to do with our contact tracing? And I think in a way that I think the public would say these are reasonable steps towards reducing social gathering in a way that, as as Dr. Ryan at the WHO had noted, if you're doing these steps, you want to do it in concert with the public who feel that they would participate in those, support those processes, because it's only but common sense to them that it makes sense to reduce those possible areas of risk in that regard. You've heard that some institutions have asked their staff to do any non-essential travel. Some have asked some of them, especially in the healthcare sector, to not travel outside Canada because we don't want to compromise our healthcare workforce at this time. And they have to consult with their local organizations and agencies to ascertain what that situation is at this time. So those are the general overall comments. And again, this is our time to really focus on precaution and cautionary principles over the next 2 to 4 weeks, and to see, can we continue to be successful in containing, as we're doing now nearly 5,000 tests that we've had, and we continue to do a lot of testing, and we're trying to ramp up that testing. We're ramping up, putting out, we'll announce shortly, assessment centers in that, so we're making it easier, trying to improve our contact with the public through telehealth and to rapidly improve so there's no delays, and trying to get the public with as much access to information as soon as they can so they can have their questions answered, their concerns dealt with, and as well as to get assessed in a timely way when it meets the qualifications and criteria, because we want to make sure our testing is, one, necessary and viable, or not viable, but valid, because if we overload the testing system, then we stall out the system, and we want to get people tested who need to be tested when they need to be tested so we can inform and take steps on our containment policy in that process there. So these are all vital, critical parts of only the few things that the command center has been dealing with. Regarding, also we've noted, I forgot to mention, that we've asked our long-term care facilities as well as our retirement homes and hospices, and I believe some of the acute care hospitals are going to start going from passive surveillance of visitors to active surveillance of visitors, to ask them, are you ill? And again, as we said before, if you're ill, even now, you should not be visiting those facilities. And especially now, we want to make sure our most vulnerable population is protected. If you have been traveling the last 14 days outside the country, we also don't want you to visit. If there is some unique circumstance where you feel you must visit, you have to consult with the administration of the long-term care facility or with the retirement home to work out some method of protection that reduces the risk to the resident or to the patient in those settings there. So we're asking to do that, as well as to continue to monitor their staff to make sure the staff have not been exposed and to any risk activity prior to coming to work on that. And again, staff are supposed to call in if they're ill and report and not come into work, and to have that situation assessed accordingly. So we're ramping up our protection around our vulnerable populations. We're ramping up our protection around our schools and institutions, as well as decreasing the public risk and being focused for at least the next 4 to 6 weeks on how we can be very cautious and keeping our containment and the risk to the general public low. But I'd say the risk for traveling Ontarians is not low. People traveling to outside areas, they could be coming in contact with all sorts of exposures they may knowingly become exposed to or unbeknowingly in different situations. And that fits with what we've been saying the last week. Do your risk assessment. Assess. If you're over the age of 60 or 50 and you have comorbidity, I would strongly recommend you do not travel at this time. Don't go on cruises. And if you have other health conditions, be cautious on that. Assess where you're thinking of going. Is it worth the trip at this time? Is it necessary and vital? And reassess that situation. We're just asking, be focused, especially for the next 4 to 6 weeks, and we'll update you after that time. So with that, I'm going to be open for questions. Thank you.
What are you recommending for daycares that aren't in schools? Like, I take it from your remarks, you said schools and daycares in schools.
What I actually meant all daycares.
All daycares, so it's every private daycare, every...
I think that I would ask them to undertake that, and then when people come, I would ask them also to, just like the long-term care facilities, do that screening. Ask the parents, is your child well? And have you been on any trips lately in the last 14 days? And if you have, then I would rather you not bring your child in today and to wait till after that 14-day period.
But it's up to the daycares themselves to screen this? It's not like you're ordering it, it's just a...
I'm giving guidance and direction to do that. Thank you.
For returning travelers coming back from one of these identified regions, is there concern that they are perhaps not self-isolating even though they're being asked to? And what kind of enforcement or measures are put in place beyond the airport, beyond being questioned by an officer there?
Correct. If they have isolated and contacted public health, even though they're not symptomatic, the public health contacts them on a regular basis, and there's that aspect there. I think the assertion that, we hear people, are they totally self-isolating or not? Have they gone out and ran across the street to get their mail? And people say they saw that happening. Well, I don't call that a high exposure, but can we put them in situations where they need to be supported? And that's what we're trying to assess. That's what we want them to contact public health saying, we're out of whatever, we feel desperate, we need to get it, what are we supposed to do? And then we would work with them to say, okay, how can we assist you in this situation there? We really have relied heavily, and so far we've been seeing that people who have been in risk situations, country and travel, have been very forthcoming in getting identified. One is that, again, we find they're very concerned about their health. They're very concerned about the health of their family and friends and that, and they usually would want to be in a situation where if they did become ill, they would like to get tested and assessed as quickly as possible, and if they need to access the healthcare system, they can do so in a way that is not only permitted, but actually supported and helpful. So we have found that so far that has been very much, our Ontario public have done that. Does that mean there's someone who may not? That could happen. That's why we're doing also sentinel surveillance, is saying if that was happening to a large extent, we would start to see widespread community. We start to see cases that have no travel history at all. But we still haven't seen that. Does that mean we're going to give up looking? No, we'll keep looking. That assesses two things. One, community spread, or maybe the lack of integrity of isolation in that kind of aspect there. Plus, as you note, there's lots of people giving information to public health. It may be correct, it may be incorrect, it may be perception. It doesn't mean we ignore it. We follow up on those comments and issues accordingly. So all information is important, but again, we're putting our confidence in that our public who have concerns are going to do the right thing and stay and protect themselves, their family members, and others in that regard.
All of the guidelines surrounding gatherings right now are voluntary. You say you prefer that people, more than 1,000 people don't gather. Why not make that a mandatory requirement?
Our understanding in the province of Ontario, if you're going to make it required by law, that would have to be an emergencies declaration, and then the government would have to put that out. So my direction as the CMOH is to give guidance on the matter and recommendations. But if there was severe, like you understand, like some countries, that certainly is in the power of the government if they declared a state of emergency and did those steps there. But that's not within my power as a CMOH to do that.
Government saying they're making all their decisions based on your guidelines, though, and it sounds like you're suggesting it might be a good idea, but you're not saying, yeah, you should do this.
Well, so far you can see a lot of them have proactively taken a step and canceled events, and it's much more important to me that, in partnership much with the public, that groups, organizations would sit down and saying, we don't want to expose the public. We want to have this as on our reputation. What should we do? We'd still like to have some activities. Can we do this? Can we do that? Or should we cancel it outright? And I think it's much better to have the cooperation of the organizations rather than people going undercover and doing things that you don't even know is happening. And so again, requesting the organizations in Ontario to be responsible and to do what's best, because if they're on events, they want to make sure their patrons, whoever they are, or groups, organizations, could be church and religious groups, are being careful with that and are trying to do their best to handle that. And we're trying to answer their questions about how they might take steps to ensure the protection of their patrons, etc.
For parents who are going to be off, for those who do have the ability to be off with their children over the 2 weeks that the schools are closed, is it safe for them to go bring their child to a place like a museum, a mall, however, what other big places they might choose to spend their time?
My recommendation there, because that's still a public venue, climbing on other stuff and where the kids are going to be there, I would suggest not to go to public venues. If you want to take them for a walk around the block and you want to do stuff like that, where it's just you and the kids and that kind of thing, I think, being housebound for 2 weeks is pretty tough for sledding. You want to go out, well, if there's any winter left, and take them by yourselves sledding down the hill, I guess you can do those activities because you're keeping them out of public venues. So I leave it for the parents to continue to do that. When I say isolation, they're not locked up in their bedrooms and that kind of stuff, of course. But there's things that you want to do that you're not exposing other children in that, and there would be reasonable steps. So someone said, well, I saw someone out with their children. Well, that's fine if you're going to walking outside. It's the same as people ask me about large gatherings. If someone's doing a run for whatever, and there's 300 or 400 people going out running 10 kilometers, and they're not in a closed space for a while, and they're outdoors, not sharing water bottles, of course, you test that and say, well, this is not a risk situation for this and that, as long as you're not clumping them all in a room for an hour before they start to run. So there's ways you assess those things. So it's the same when I mean isolation. That means not exposing to other children, because we're not sure that young children especially, and of course, they don't take hygienic steps, and you can't be guaranteed what they might or might not do. And I think other parents would say the same thing if you were doing that. So I think parents, again, would want to do the right thing in that and follow that. So I'm not saying strict rules, but I would rather not go to public settings like that, because during the March break and that, I think a lot of families take their kids to large venues like that, and so they'd be highly attended. And I think as a parent, you'd like to know that the ones in there are not ones that have had some travel history, so your children, if they're attending that, are not put at any further risk during that event.
Is that your advice for people with children and not just the general public? Or is it your advice for the general public to stay away from public places?
Well, I think if you've been outside Canada, well, if you've been to Iran and those other ones of the 3 countries, then you should not be. I think if you're monitoring, you're in good health, because I think adults, better than children, can monitor. I have trust that they can take that responsibility. But we found some where the children, where the parents, wasn't sure they were really ill at all. And we've seen some in some other countries, and now here, I'm not sure the stats of the ones we had here exactly. I don't think they're that ill. They may be harboring, you don't know it. In that, so that during that time, when you're in the 14 days, as a parent, you might become ill and you might have to be assessed. And then, as I said, in that case, then not only you and your children would be in isolation for a further 14 days until that time period is over and you have the 2 negative tests within 24 hours. So I trust that the parents in that, because you have 2 parents, one may say, I'm going to work. I assume they're being responsible and saying, I'm not ill, I have no signs or symptoms, and I'm monitoring, and I've told my boss and whatever, I'm coming into work. Because as far as they know, I don't think my child is sick, but we can't tell for sure, and we want to be careful in this situation and do that. So that's the same thing as, but the parents have the ability to make the decisions responsibly and to be responsible Ontarians and do their self-monitoring appropriately.
Doctor, the provincial government is gearing up for its budget on March 25th. As part of that, of course, is the budget lockup, where 2,000 people will be locked up for 8 hours in the Metro Convention Center. I'm just wondering if you think that this is advisable given other public gatherings that are you're advising against.
It's a good point. I'm sure in the haste of putting that together, the finance minister may want to take that into consideration. So I think you'd have to wait and ask the finance minister or the premier about that specific question. It's a good point to raise.
But what would your advice to them be about having 2,000 people under one roof at the same time?
Obviously, if it's over 1,000, it would be concerning. And if necessarily got some steps to separate them different ante-rooms in different areas, there may be ways to do it in that way. I don't know how the system's going to work. I wasn't even sure where they're going to hold it yet this year. So I think you will have to ask either the Premier or the Minister of Finance about that question.
What about the legislature?
Can you talk a bit about how it affects... Sorry, go ahead.
Either one.
Okay, go ahead, Alison.
Can you just talk a little bit more about how effective social distancing is and why we do it exactly in these scenarios?
I think, in my mind, if you listen to, I was very much in agreement with Dr. Ryan of the WHO when asked about that question. And he was very much clear to say that social distancing is something you do, like with quarantines and large gatherings, that if you're not too sure if it's community spread and you're not too sure where it's coming from, where it's going, you try and put those things in place. He said the preference is very much do a strong containment modality. And that means cases, contact tracing, encircle those clusters and outbreaks and control it. If it's an adjunct that is added to it, it does help. But its key importance, as he noted there, is they're only as effective as the public's compliancy with them. And all along, we've depended heavily on the public and trusted the public to come forward to do the right thing in the right way. And I feel that a public that's engaged in the process, as we're asked them to do, including if we do things around what we're talking about now with large venues and with schools and that I think the public would say, this at this sense, this does make sense. And I would support that. And I would support that my peers and other people around would do the same thing. So if you have a strong public support, your social distancing methods are highly more effective. And that means in things like on public transit, all clustered together, use cough etiquette. We've always said that. Wash your hands, those things. Because this is an Ontario, writ large, involvement. The times have changed, and we're trying to do everything we can, because in Ontario, we don't want it. And by doing this, we can handle that. And I think that Ontarians whatever your background, that have and continue to respond responsibly in this way. And I would encourage that.
Sorry, why wait a day to close the schools, though? Why not close them as of right now? And also, universities and colleges, your thoughts on what to do there?
Well, I think you're going to ask the Minister of Education the question. I'd recommended that one aspect there, when they come back during that 2-week period after March break, it adds a further sense of protection, so you're not clustering the children together in that one there. While I'm anticipating that the parents would be highly responsible and not put their children back in the school, I think there was some concerns that some may feel due to work situations and issues they may just do so. So I think the Minister of Education, and that you're going to ask him when he's here, to ensure that protection for that 2-week period after the March break, which is that almost like isolation period, reduces the amount of contact and the potential there, both for staff as well as for children. So.
Can you talk a little bit about how the confirmed cases, how those patients are doing, how they're recovering, and also whether you're seeing that they're getting 2 negative tests after a 2-week window?
Sure. They are, I mean, other than the new ones, which we're just gathering information on through the local health units, there was one that's still hospitalized, but apparently the condition is improving, which is great. The rest are recovering at home. And the process we use is we wait till they are totally asymptomatic, that is, they feel fine, and then we have somebody get the tests for nasopharyngeal and throat swab, and as soon as we get one negative, then we have to wait at least another 24 hours to get the second negative. But sometimes it takes time till they clear it completely. But they continue to be monitored by the local health unit, and they're all doing well.
So Richard, you had a question. You got bypassed. Did you want to ask your question?
Sorry, yeah, I was just going to ask about the legislature, because they voted on a motion to allow the government house leader to give notice to the speaker that they might need to suspend the legislature for health reasons. Have you given them any guidance on that, or will you be giving them any guidance at what time may be appropriate for them not to be in committee or in the House or scrums or whatever?
Well, I would just advise that motion had been passed, so I haven't had a chance to have any discussions on that. I think it would be more if there was some evidence of a health hazard or a potential issue with COVID-19 that might be impactful upon either visitors or members, and then they would be seeking advice from my office that if that was the right thing to do at that time, that we would be forthcoming and giving that to the leader of the House to advise him accordingly.
So it's the kind of thing where we would need to have like an identified case of someone in the building before that would happen. And
mine is always a health issue driven by data and information. Yep. And if there was a potential or possible or probable, I would want to advise them accordingly, as I would with any setting, as any public health official would say. Is there concern in a workplace situation that there had been some potential exposure? What steps can you do to contain and that's all part of our containment process.
When you spoke yesterday, we spoke yesterday here. It was much more of a case-by-case basis for these types of large events and so on. The Premier and the Minister of Education this morning seemed a bit more optimistic. What particular metrics or data did you look at between now and then to make you change your mind?
Well, given that I was here yesterday and Dr. Williams was elsewhere, it's a very quickly evolving situation, and as I said, we had 17 new cases over the last 24 hours. We were getting, lab reports every few minutes. It was, concerning, and we see the worldwide situation evolving. And so in discussion with the command, table, and also with our peers across Canada, the other province and territory chief MOHs, we feel that at this point we have to act more decisively to protect the health of the public.
Two more questions.
To go forward, is there any are there any particular metrics or data that you will look to in order to further escalate the type of measures that we see?
With the large groups?
Yes.
Yes. That would be like if we have one where there has been potential infection in those large groups, and we're advised further about some actual spread or containment in there, that the local medical officer says, in this gathering here of, say, like 200, it seemed to be quite good, but then we found out that in spite of those protections, something happened. We'd have to ramp up even further, say, obviously those kind of measures did not prevent adequately. So we'll be advised by those metrics of any cases and contacts that would indicate of success or lack therein of large gathering limitations with exposures to the general public, and especially about those with high risk. That means the elderly, comorbidity, autoimmune, suppressed people, those kind of situations.
When it comes to testing, we're hearing reports that people who are feeling sick and want to be tested are being turned away. Other people who are being tested have to wait long waits. Is there a backlog? Is this happening? And what can you tell us about that front?
Our understanding is that our testing still is within the 24, 36-hour period or shorter. We do batches and run them through in that one there. So we haven't yet reached our capacity on our laboratory testing. Sometimes there's delays if you're from the far ends of our province. You have to get the sample down to PHOL. And those are kind of metrics that should happen fairly easily, but sometimes there are holdups in that regard. As far as the seeking advice in that, we've had some comments that there's been some long delay of speaking to some people. We find that I think most want to talk to a medical person. Sometimes they want advice just from telehealth to say, okay, can you call this number or that number? We're hoping to be able to pick up on and get even more load capacity through that to make it expeditious. As well as we get our assessment centers up and running, it may be that telehealth gets a call and the person says, well, I'm located here and I need to have this. Say, okay, here's where the number, why don't you call them and they'll talk to you. So you move it through quickly to the appropriate center to do that assessment. So we're trying to pick up on our assessment sites so that it's much more timely, and to deal with the concerns of the individual, maybe advice, maybe direction, maybe signs and symptoms. There's many things you want to assess in that. We're trying to roll out even self-assessment tools and use of virtual methods in there, trying to incorporate that our healthcare community would have less time of face-to-face contact. They could handle a lot more over the phone, and we're looking at ways to do that in a timely way, an efficient way, without compromising care, of course, but to ensure that our system is not overloaded in this time. So these are all part and parcel of what our command center is talking about, and the details of that we're going to be coming out with shortly.
I know we're trying to, I just want to add to that answer that we are hearing that some people who are asymptomatic are wanting to get tested, and there's no reason to test somebody who's feeling fine. And so I think it's partly getting the right information, as Dr. Williams said, but we are working on increasing the capacity of testing by across Ontario.
Dr. Williams, you said risk to Ontarians here is low. For anyone traveling, not so low. So are we at that point where you're outright asking people, if you don't have to travel, if it's not essential, don't do it?
We are. Yeah, that's where you have to balance out. I mean, if you feel you really have to go, look at all those risk aspects. Personal. Where are you going? What are you doing? Who you come in contact with? How long are you going to be there for? What protections are you going to put in place to limit? And the fact you may be required to self-isolate if some situations evolve that you didn't anticipate, or flights may be interrupted and you can't get back. So you're going to have to weigh all those things into consideration.
Okay, thanks, everyone.
Thank you.
Good afternoon, everyone. Thank you for joining me. Just before I comment on COVID-19 and the government's continued action to keep citizens, particularly vulnerable segments of our population, safe, I do want to confirm that the Crown, the government, in conjunction with the trustees and Catholic teachers at OECTA, have reached a tentative agreement that is good for students, it is good for educators and workers, and good for the people of this province. And we are Just very much focused now, moving forward and looking forward to getting further deals with our other education partners to provide stability that every Ontarian deserves. Today I'm here to talk about, as well, the health and safety of Ontario's school communities. And I want students, families, and the broader community to know that this remains our foremost priority for our government, keeping children safe. It is priority number one. Since COVID-19 became an emerging public health issue, the Minister of Health has been active and engaged with the Ministry of Education, school boards, and our communities on the robust protocols in place to monitor, detect, and contain cases of coronavirus. Since day one, the government has been taking decisive action to ensure that the province is positioned and ready to respond. On day one of the first confirmed case, on my request, I asked the ministry to coordinate a call between Ontario's Chief Medical Officer of Health and all school board directors of education. As well, the Ministry of Education is hosting regular teleconference calls with all school boards to receive real-time updates and ensure the consistency across the province of information flow. Earlier this week, I convened a conference call of all ministers of education and deputy ministers from across the Federation, right across Canada, to discuss a coordinated response to COVID-19. It was an opportunity to discuss best practices, to coordinate responses, and look at ways to enhance protocols. We discuss school closure criteria, the continuity of learning, and available resources and supports. Given the latest developments, both internationally and here at home, today we're taking further action and precautionary measures. I want Ontario families to know we are unwavering in our focus in keeping students and staff safe. That is why today we are providing additional resources or taking action to provide additional resources for sanitation and personal hygiene products. Moreover, as we head into March break, it is clear that there will be an increased travel and exposure to the virus as students and their families travel. And I want every parent and family to know with confidence that when their child returns to school, they will be in a safe and healthy learning environment based on the medical advice of Ontario's Chief Medical Officer of Health. The government has received the advice of Ontario's Chief Medical Officer of Health and the COVID-19 command table, recommending that the province close down all public elementary, middle, and high schools for 2 weeks following March break. I have swiftly accepted that advice, and I've issued a ministerial order under the Education Act to close all publicly funded schools from March 14th, 2020 through to April 5th, 2020. We are taking decisive action to keep your child safe. Nous prenons des mesures pour assurer la sécurité de vos enfants. Following this 2-week period, we will evaluate the situation and decide if any further action is required. While the health and safety of students, staff, and the broader community is of utmost importance, the continuity of learning is also an important consideration. And we're looking carefully at options and solutions, and I'll be announcing them further action in the coming days. However, I can confirm that there is a plan that is being finalized that will ensure learning continues in this province for students in Ontario. I want to thank our teachers, our administrators, our staff, our local public health units, hardworking nurses and doctors for their incredible public service and for the dedication to the health of all Ontarians, including our youngest. I also want to express my gratitude to the Deputy Premier, the Minister of Health, Christine Elliott, for her leadership, in addition to the Chief Medical Health Officer of Ontario, for their work constantly in the interests of the public. I now will take some questions.
Minister, does this mean that you said that learning will continue? Does that mean there'll be some kind of an e-learning component for students during that 2-week period when schools are closed?
We will be announcing the program related to the continuity of learning in short order, but I want parents to know priority number one today is to take action following the advice I received, that the Cabinet received just hours ago with relation to keeping schools open. And we've made a decision on the advice of the Ontario's Chief Medical Health Officer to close schools for 2 weeks following that period. With respect to how do we achieve the continuity of learning, I'm committing to parents that there is a plan, it is in place, it is being finalized in real time. And I will communicate transparently to parents about how we ensure your child continues learning in a safe environment out of schools. But I will report to you in short order.
Will your be extended then? Is that one of the options you're looking at?
I think at this point we're seeking the advice of Ontario's Chief Medical Health Officer about where this goes. At this point, his advice was a 2-week period as a precautionary measure. We take that advice and we've swiftly and immediately acted to implement it. However, if that advice changes and the situation worsens, I think we will immediately and swiftly take that advice and implement it accordingly. At this point, it looks like there's a 2-week period of time where schools will be closed. That is a prudent decision based on the medical advice of Ontario's Chief Medical Health Officer, and obviously science will guide all decision making in the ministry and right across the government.
Many parents will already have used up a fair bit of their sick time, their vacation time, trying to watch their children while they've been out of class. Does the government expect employers to be very sympathetic to parents during this 2-week period when they may not be able to come into work?
You know, it is an extraordinary time, and I think, we're asking for a sense of a compassion by all parties to ensure that the safety and health of citizens, of workers, of taxpayers, of students, of seniors, every citizen in this province, I think, deserves to have deserves to be in a safe space and deserves to be safe from this virus. And so, that is a decision point businesses will make in consultation with their employers. However, obviously, the federal government has unveiled an expansion, announced their intention to expand EI, unemployment insurance, during this period. It is an opportunity to look at expanding the EI program to include, of course, individuals who are affected by coronavirus personally, if they have a presumptive positive case. But in addition to looking at providing additional supports, should an individual that is not presumptive positive but is watching a child, that additional support could extend there. So we're working with the federal government. As you know, the Premier of Ontario was in Ottawa, albeit briefly, but was with many ministers, and is advancing that message in collaboration with the federal government. Is a time that I think all members of the governments locally, provincially, and federally work together in the interest of public health. It's the leadership that Premier has demonstrated to date. And obviously we welcome partnership, as we've seen so far from the federal government, on how we could improve the lives of individuals that are financially upended as a consequence of the spread of this disease.
Just
On strike days.
What do you think the economic implications are going to be, though, for potentially hundreds of thousands of parents having to stay home for 2 weeks?
I think we appreciate so much the impact that this will have on families and on parents and on working people in the province, and we recognize the difficulty this imposes on so many members of society. My obligation as the Minister of Education, and under the leadership of the Premier as well as the Deputy Premier and the Minister of Health, we have a shared commitment to maintain the safety of every person. And we have a decision point before us on the advice of Ontario's Chief Medical Officer, who has said that schools should close for a period of 2 weeks following March break because of increase of travel that is normative during this time of year. That is a prudent step, one where we recognize the difficulty it imposes. But our commitment, and I think a shared commitment, including of parents, is to do everything we can to ensure the safety of their children, given the vulnerability of young people and staff. And that's what we're doing today. We'll continue to work with the federal government and other levels of government to ensure that the programs that exist support parents that are affected by this. But I think, the obligation I have is to take action to ensure safety and to listen to the medical advice, and that is precisely what the government is doing today.
For strikes and so on, your government has offered compensation to parents because they have to figure out childcare and so on. Obviously, there's going to be limits on childcare during this time. Is your government open to having further compensation to parents who would need to hire childcare to look after their kids in this 2-week period?
I think the first commitment and what I'm announcing today is we're following the advice of Ontario's Chief Medical Health Officer. I think what I'm also intimating is that there has been an expansion of unemployment insurance and EI supports for parents through the federal government. If there is a way we can ensure that program captures all individuals affected by this virus and the spread of it, that would be the best way forward. But I think at this point, my commitment and my focus in the immediate term is to ensure that we have the continuity of learning, to make sure that our staff and personnel in schools, and of course our kids who are vulnerable, that they remain safe. And that is the immediate priority. And we'll work with the federal government and all levels of government to look at additional supports that may exist. As you know, the province has announced a $100 million fund, a contingency fund for COVID-19 that the Minister of Finance, the Premier, the Deputy Premier yesterday announced as part of our response. The federal government has announced $1 billion of supports. There's monies that are there, and the question now is how do we best put those dollars to work to improve health, to provide resources, access to materials or sanitation, masks, etc. That's precisely what we're doing. under the guidance of Ontario's Chief Medical Health Officer.
I just put this into place because it starts March 14th, but kids will be going back to school tomorrow at some boards. So why wait?
Well, the Ontario's Chief Medical Health Officer, I think, did respond to that question just following a period of travel. His advice was to mitigate that risk by closing schools in Ontario for the 2 weeks. And the assumption, of course, is that students will be going on March break, really once it starts, essentially Saturday. So I think his answer, in short, was based on the increase of travel and therefore the increase of risk, that the province should close schools for 2 weeks as a precautionary measure for public schools in Ontario. And that is what we're doing. He did answer a question when asked about his recommendation to parents for tomorrow, and I think people will heed the advice of Ontario's Chief Medical Officer, whom we have absolute confidence in, and who has very ably managed this difficulty in Ontario well. And I think we should all be looking to him for advice on the way forward to ensure the safety of your child.
On the OECTA deal, are you hopeful that this will sort of be the first of the dominoes, and the other 3 unions will settle?
Yeah, my aim through this process from the very beginning was to land deals that keep your child in class. I'm absolutely committed to building upon the momentum with the deal signed, the tentative agreement reached with OECTA and the trustees in this government. I think what is important is that students remain in class and have a good deal that is good for them, that improves their lives, gives them every skill and opportunity to succeed in life and beyond. And we believe that this deal does it with OECTA, and we believe that it hopefully will build momentum for further deals that ensure stability for every child, Catholic and public, English and French, in all parts of Ontario. Thank you so much.
Teachers continue getting paid during the shutdown, and other school staff as well, or is there, a mechanism to do like a temporary lockout or anything like that?
I believe the answer is yes, they are, and I think any questions related to local boards would go to the local board authority. Thank you so much.